Okay. Concussions. Alternate names. Brain injury. Do you want to define it, Araceli?
A traumatic brain injury that alters the way your brain functions. Effects are usually temporary, and levels of brain chemicals are altered.
It's usually caused by a blow to the head, but sometimes it can happen because your body is being violently shaken. And then the signs and symptoms can be subtle. How do you speak? Okay. Or they can last for days, weeks, even longer. They include headaches, temporary loss of consciousness, confusion, amnesia, dizziness, ringing in the ears, nausea, vomiting, fatigue, and slurred speech.
Diagnostic test, neurological examination, vision, hearing, strength, sensation, balance, coordination, and reflexes. Cognitive testing, memory, concentration, ability to recall
Information.
Oh, okay.
Yeah.
And a CT scan.
Yeah. And on CT scans, sometimes they can see bleeding in the brain, and that's like, obvious sign. And then for treatment, they do physical and mental rest, so they don't let you do anything that requires a lot of thinking or moving. That includes watching TV and stuff like that. And then you can take pain relievers like acetaminophen for headaches, but you can't take aspirins because that promotes brain bleeding, and that's not what you want when you have a concussion.
Complications are epilepsy, the risk of developing
Doubles after the first 5 years. Yeah, like after you have a concussion, you can have epilepsy. And then the cumulative effects over time, like if you have a lot of concussions over time, like when you're older, it'll kind of, have its effect on you. And then there's this thing called post-concussion syndrome, which is whenever you just have a headache and stuff after, your concussion. And then there's something called second impact syndrome, and that's whenever you have a concussion and before that one even wears off, you have another. That's pretty bad. Yeah.
And prognosis after rest is good.
Yay!